Our aromatic journey at this conference is now traveling to the Netherlands with a very special presenter who will not only be sharing his heart's process, but also what's on his heart and his heart's work. Jonathan Benavides has been a psychologist specializing in communication problems such as autism spectrum disorder, ADHD, PST, and major depressive disorders since 1986. He has always been interested in research and integrating different disciplines while developing new sensory therapies for autistic individuals at one of the psychiatric hospitals in the Netherlands. Jonathan began studying advanced clinical aromatherapy in the UK in 2002, and since then, he has continued to extend his aromatic knowledge. He has also been working within the palliative home care system in the Netherlands since 2009, incorporating his skills for providing comfort. Over the years, he has developed, used, trained, and lectured at home in the Netherlands and internationally in diverse therapeutic interventions, conventional and non-conventional healthcare. He is a clinical aromatherapist, psychologist, the Heart's Process teacher, aromatic sentinel creator in the Netherlands, educator, counselor, researcher, lecturer, anointer, international speaker, author, and ambassador in the Netherlands for the Aromat Institute, and director of Ascension Nobilis in the Netherlands and Portugal. What a resume he is bringing, and what a wealth of knowledge that he is bringing to us. He also leads some great retreats in the Azores in Portugal, and he is presenting today on using the Heart's Process, the aromatic support for emotional pain and mental distress. Hearts is an acronym for hands-on empathy, aroma, relax, texture, and sound, and is therapeutically offered drawing on a range of natural skills and different sensorial experiences with the aim to use in all kinds of clinical settings in private practice and at home. Welcome, Jonathan, to the NAHA conference.
Good morning, everybody. First of all, I would like to thank very much Annette, Jennifer, and the board of directors for inviting me to be here today with you. And we're going to talk today about pain. But first of all, who am I? You have seen that she has said that I'm a psychologist, I'm a researcher, etc., etc., etc. But I think that the most important thing is that I am a kind of therapist that work with people who are in isolation. And I specialized in communication disorders. That was my first approach to therapy with autism. About almost 30 years ago, I started. And through autism, I got into aromatherapy, trying to get contact with children who were not allowed themselves to communicate. I was looking into how can I get to them. The children, the autistic children that I work with are not the common autistic children who just see at home, but with children who are isolated within a mental institution. So they're very aggressive. They automutilate themselves, and you need to apply everything you can to get to them and get contact. So trying to do that, I started to look into the senses, the most primal of all, and I got into the olfactive sense. And through that, I got into aromatherapy. This was about 20 years ago. And since then, after applying the knowledge of aromatherapy with the children with success, I never left the aromatherapy world, and I'm here. So I work also with ADHD, trauma, and depression. And about 15 years ago, I started to work with pain management through cancer patients. I work at the moment also in psycho-oncology, working not only with cancer patients, but also with cancer survivors who are I don't know how it is here in the US, but in the Netherlands, after someone has been cured of cancer, then leaves the care system and does not return until something happens. I think it's very important to work with people all the way, not only during the cancer journey, but also after that. And I work also with the family. We need to integrate always the people who are together with the patient. That is something that normally does not happen also, because we are paid to work with one person, the person who is sick. That's all. And I said, no, you don't have just one sick person at home, because if you get cancer, the whole family is in the journey. Everybody's suffering, everybody. So we need to address that and work in home care or inpatient with the family and not just with the patient itself. And I work also in end of life care. And there in the Netherlands, we have euthanasia. So I prepare people who have decided to go through that and the family, so that the process becomes as easy, if possible to be easy, of as we call it sweet and easy, in the sense that they could really allow themselves to let go, and the family also to let them go, something that's very, very important. And I work with different kinds of pain. I work in National Public Service, and I see different kinds of pains, such as physical pain, emotional pain, psychological pain, relational pain, and spiritual pain. And sometimes we get people who are suffering one type of pain, sometimes three, and if we go into end of life care, we see people suffering from all five types of pain at the same time. And aromatherapy helps with that. I see myself as working with someone who is isolated. If a child is autistic, is isolated in a way. If you are suffering from ADHD, you're isolated in your head. Someone who is with depression is isolated also. So we can use the aromatics to try to get that person, if they want, because only if they want, we can use it to get them out of where they are and try to bring them back to life. And today we're talking about emotional pain, something that people don't see. It's like to having a wound, an open wound. You're working every day, you're studying, you're working, and your suffering is inside of you. It's a very subjective type of pain. When someone said to you, I'm in pain, we have to believe. We cannot say, oh, but you don't look like someone in pain. I don't see it on your face. I don't see it on your body. You know, you're just walking, you are doing everything, but the person is in pain, and we have to acknowledge that and work with them through their eyes. If they come to us, they come for them, not for me. So we have always to look at the person, and from their own perspective, we can take them out of the pain, only if they want. One of the things that I ask always everybody that come to my practice is, have you not suffered already enough? When you say such a question, you get someone reflecting on the patterns, the behavioral patterns, the pain patterns. For many people, they have a pain body. They are not the pain. The body is in pain. The mind is in pain. But you are not pain. You are Mark, you are Peter, you are Mary, you are beautiful, you are a mother, you are a father, whatever. You are not pain. The problem is that emotional pain, that is acute pain, can become chronic. And when become chronic, we are talking about mental and psychological pain. Of course, the pain is felt, but not 24 hours a day. I have not encountered ever someone who has always been in pain. And that is what we can use that's where we can use the essential oils. Because I see aromatherapy as a positive aromatherapy. Always something that is really to take, or to take, yeah, we could say to take the best of the person and show them that they're still able to feel pleasure, to feel good. And that is something that I try to convey to them through the use of essential oils. I don't work only with essential oils. So I always say that I am an aromatherapist. So I am a therapist who works with aromas. I am not a therapist who works with essential oils. So I use all kinds of aromas. For instance, when I work with children with cancer, I use the perfumes of the mother, together with tangerine, for instance, together with vetiver. But what the child needs is the mother. They don't need vetiver and tangerine. And the mother will be brought back to them with a pillow where he can smell mama. Also, if you look into people who are 95 years old, who are in pain, what they are looking at and what they are saying is, Mama, where is Mama? They don't talk about the children, they don't talk about the grandchildren, but Mama, where is Mother? So if we can go into aromas like very old lavender talc powder, for instance, that we use, it's not the lavender essential oil because it's a different type of lavender. It's very powdery. And that aroma brings back mama to them. We do it together with vanilla. We use also chocolate, or we use also watermelon for children. There's no essential oil of watermelon, but we have a synthetic aroma that really helps to make them feel pleasure, to make them feel good again. And the idea is to take something chronic back into acute, and from acute to no pain. Psychological pain is something that we see a lot in the hospital with psychiatric patients, especially people who are suffering from severe depression. As you may know, some people have depression and just goes with no medicaments. They just been cured within 3 months. But there are other people who can suffer depression for 6 months, for a year, for 10 years, or all your life. And we see that especially when we're looking about grief. People who has suffered the loss of a partner suddenly, for instance, and I'm not talking about someone who was sick for a long time, but just was diagnosed with cancer and within a month is gone. The partner, the children go into a very, very long sorrowful and grief period. and they can go into what we call chronic grief. And that becomes also a psychological and mental distressful situation for them. If we look into cancer, we look into fear, into what's going to happen with me. I'm going to die. I'm going to be cured. What will happen to my children? What I am doing to my children? Because that is the relational pain, is related to why I am sick. Why? Suddenly, I get this. What's going to happen to my children? And I work with young mothers who have small children. And we know, they know that they are going to die because they have been out treated. And they are there with the children. And how is possible for her to tell children that mama is going to die? She cannot do that. She cannot. So we make a whole situation, a whole thing for the whole family, so that they start realizing what's going on. Because the children need to be also put together into the picture. We have to relate and integrate everything so that the passing will be as sweet as possible. And we see here that people are suffering a lot. And what we do, what we try to do, is to bring them from pain to well-being. That's the idea, to have a better quality of life. Because that is something so important. We have to realize that quality of life is until you are dead. And sometimes someone who is very, very, very ill and they are in pain, and you just use all kind of meditation practices or hand massage, foot massage, and they just get into a very special kind of state, a mind state of quietness, rest, tranquility. Then I show them oils for them to start triggering memories, past memories, good memories. That is what we're looking at here. And to bring people from pain to well-being, we use hearts. Hearts is a technique that was developed by Ann Carter in Manchester in the UK about, I think, 30 years ago in an hospice, and has components as hands-on, empathy, aromas, relaxations, textures, and sound. And within the aroma component, being an aromatherapist, I have developed some years ago 2 extra aromatherapy component, let's say, one I call Train to the Light, where I use aromatherapy and sound. This is especially for people in palliative care and end-of-life care. And remembering and honoring you, aromatherapy and textures that we use especially with old ladies, because you ladies have more life than us men. So we see much more old ladies that has been left behind by the husbands. And nobody take care of them in the sense of, how do you feel about your husband? He left you behind. How do you feel about that? So during a heart session, they become the actor, let's say, and they are the ones who start talking. And they start communicating again with their husbands. And we do it using photographs. And that photographs, we put them inside what we call a twiddle muff that you have seen in the picture. And they are just touching. They have an aroma patch on the shoulder, and they are smelling, they are talking. And what they are smelling, sometimes tobacco. Tobacco, because the husband was someone who was smoking. Or Old Spice. You remember the Old Spice perfume? Well, I have it, and I use it, and they love it. Those old perfumes are so precious in our aromatherapy world. Don't throw them away. Why we use hearts? Because hearts is very subtle, very gentle, and we are working with people who are very, very fragile. We have to remember always that the patients are in a very fragile state, not only physically, but also emotionally and psychologically. So hearts was developed in an hospice. In England, aromatherapy is very much related to massage. So to work with the oils on the body. And if you work in the hospice and you provide massage, well, not everybody can have a massage, especially if you are in the very furthest late stages of life. You're in a lot of pain, you're in distress, you don't want to be touched. Sometimes you go to someone and say, no, 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 don't touch me, don't touch me, don't move me. You go there with essential oils and they say, what's that? That stinks. Oh my God, what are you doing? So what we have learned from that, and that's something that I learned many, many years ago, especially when working with emotional pain, mental pain, you need very, very, very little oil. How less you use, how deeper you get, how far you go. So I dilute the oils. For instance, I have 5 drops of any oil. So lemon, for instance, or spikenard. So we're talking about 2 completely different way of very, very light to a very heavy oil. Both of them is just 5 drops in 10 cc or milliliters of jojoba. And I keep that for a month away. And from there, I go further diluting it up to 5 times. So within a period of 6 months, I have my kit. And many people think, but how can that smell, after diluting, then you don't smell anything. Well, try to get one of those highly, highly diluted oils into the nose of someone who is very fragile, or an autistic child, or someone who is in a severe depression, and they will find it quite heavy, even if we don't smell at all. So we need to see that we have to use very little oil, and we have to use some way of touching someone. Because if we cannot give a massage, we can use touch, intentional touch. Very important. We're not just touching someone. We are bringing our own energy into them. We have to have a goal. We have to look at them, and they have to tell us what they need. It's not me telling what is good for you. It's you telling me what you need. And if I can, I will provide it. So hearts was done for people who were not able to be touched in a way. So we use hearts not only in end-of-life care, but we use it also in hospitals for people who has been in a car accident, they are broken. The whole body is broken. They cannot be touched, of course, in many, many places, but we bring comfort. We provide tranquility through just subtle touch. We are not moving the hand. We are just touching, and we remain there. Also, they don't need to remove the clothes. They can be sitting. They can be lying down. And if we look into what happened in a typical heart process session, we have the duration is between 5 to 30 minutes. Depends on the person, on the state of the person, and they are allowed to talk, something that we see rarely, because they see you as the doctor. I'm not a doctor. Yes, you have a white, coat. Yes, but I'm not a doctor. I'm a psychologist. Okay, so you can talk. I give you permission to tell me what you need. If I'm touching you and you don't like it, please tell me, stop. I don't want it. Enough. When you give the patient the responsibility of the event, they will feel empowered. They will feel that they can communicate what they need. What you are doing good, so please, I need more. Yes, yes. When you touch a tumor with your hand, you just place your hand on a tumor and you stay there. After 5, 7, 8 minutes, without moving your hand, many people have such a relief, such a relief. Many people are so afraid of touching cancer patients. Many people think a cancer patient cannot have a massage. But we know now that is one of the best things that can happen to them if they are touched. And as we say here, we don't need to take the clothes off. That's very safe for them too. We can do it sitting down or lying down. There's no lubricant. We don't use any oil, with any carrier oil. There's no techniques. There's no protocol. There's no routines. It's free. One of the things that we really need to do is to ask for consent. You need to ask, and they have to give it. If they don't give it, you don't do it. The problems we have with people with dementia is that they cannot say, yes, please, I want it. So we have to look. First of all, of course, we have consent from the family, written consent that we can do it. And then we look into their own way of non-verbal behavior. Because if you are really looking into what they need and what they want, you will really see when someone said yes or no, even if they don't speak. And after that, we have empathy. And empathy is different than sympathy. We don't have compassion with them. No, we are empathetic. We try to build empathy. Empathy is very difficult for many people because how can I feel the same kind of pain? I don't have cancer, so I cannot feel that aggravated pain. But if you look into your memory, I'm sure that at least once in your life before, you have had a very, very severe tooth pain or a horrible tummy pain that you were just, well, that kind of pain. If you go into that memory, then you can imagine a little bit how the person feels. And when I go into that memory, then I know that I cannot just go and touch. I have to be very gentle, very soft, because that is what I wanted for me when I was in that situation. So empathy is something that we develop. And then we use touch. In hearts, there's always touch. We have different elements: stroke down, adapted palming, fingertip brushing, therapeutic holding, and breeze strokes. And the wonderful thing about hearts is that we can do it in the whole body. We can perform it just on the head, or on the shoulders, on the hands, or just on the feet. We use it, for instance, a lot in the hospital for people going through chemotherapy. So while they're going through chemotherapy, we are performing hearts on the feet. The attention goes to the feet, not to what they have on the arm. So they can relax much more, they can focus on something else, and that brings that the chemotherapy traumatic event is as less traumatic as possible. And we can use hearts for any kind of procedures, for any kind of medical treatments. There are no contraindications except if you are using drugs, or drugs, I mean, as a drug addict, or if you are completely drunk, for instance. That's something that we don't do. We have tried that when people comes into the hospital and they're passed out with drinking problems, but didn't really work. So there are few contraindications for hearts, but normally we can use it every time. How do we use aromatherapy? We look at aromatherapy as a non-pharmacological intervention, always like that, looking into the relation between the mind and the body. And we use here in two capacities. We look into the ability of aromatherapy to alter the patterns of negative thoughts. So from something negative going into the positive, especially regarding feelings and emotions. What we tried is to trigger that positive remembrance. And also we look into the capacity of essential oils to bind interactions to neurotransmitter receptors. And we do this especially because, for instance, in depression, when you get depression, you go to the doctor, they give you antidepressants, but the antidepressants don't work right away. We are used to go into Google and have an answer within 2 seconds. If Google is slow, we get very anxious. We get very, what's happening? What's happening? Well, if you have depression and you get pills, you want the depression to go away also in 35 minutes, because that is what yours is supposed to do. I'm going to be well just like that. But with antidepressants, it's different because the working is only after 15 days. After 15 days is when the antidepressant is really working. So we see, especially with cancer patients, and there, if we look in the whole spectrum, breast cancer, lung cancer, and colon cancer, there are people who get the antidepressants, and we see after a week that they don't feel better. They're still depressed, maybe more depressed, because I'm using these pills and nothing is happening to me. So I get even, it's getting worse, and they stop the treatment. That is something that we saw many, many times and with many people. So I said, you know what we're going to do? We're going to mimic the effect of the antidepressants through the use of essential oils, through massage. So what they get now is they get the pills and also a recipe for 3 massages for a week. So in the 2 weeks, they get 6 massages, full body massages with certain essential oils. In that way, they can start feeling what they will feel when the medication will really be working. So what kind of oils we use? There are different neurotransmitters. We have the GABA. There we're talking about GABA A and GABA B receptors. And the oils that we use to have this soothing kind of effect and the person is lavender, coriander seed, Roman chamomile, rose otto, petitgrand, violet leaf, and ylang ylang. All of them, as I said before, very, very diluted. If we look into serotonin, we have bergamot, lemon, frankincense, rose otto, clary sage, blood orange, cinnamon bark, and ylang ylang, also very diluted. And if we look into dopamine, we see here also bergamot. Bergamot comes always into the blend. Sweet orange, vanilla, Spanish sage, lemon, rosemary, cineol, and the lavender. And there we use high altitude lavender. That for me is the more less lavender, because people think that lavender is like paracetamol. That's how we call lavender is the paracetamol of aromatherapy. You use it everywhere and for everything, and everybody loves lavender. And really, not everybody loves lavender. You know, people just put lavender there, and that's why we use it very, very little. And then, if we look into trying to mimicking the effect of certain essential oils in the brain, we look into the other part, and that is the aromatic memories, the true aromatherapy, we could say in a way. And we have always been smelling, as you know. Smell is the only sense that we cannot escape from, because we can close the eyes, I can shut my mouth, I could, be deaf, but I cannot close my nose and be alive after some minutes. So we cannot escape from other. And we have been building memories in us, or aromatic memories, since we were just born and until today, and tomorrow we will continue in doing that. And we have the aroma of a flower, a person, a perfume. Everything gives us this information if it was a good moment for us or was a bad moment for us. Because that's something that we have to remember all the time, that the person has also bad memories. And we need to know, we need to try to get the information from them, which oils we don't use, which oils will bring them back to a traumatic event. So we need to communicate with the patient. We need to talk. They need to talk with us. They need to talk. Otherwise, we have a very bad memory fixation again and again. If I remember what we did 25 years ago with trauma, we just let people talk and talk again, and they come a week later and they will continue talking on the same problem. We know now that was really disastrous, because if you come, you tell me what's happening with you. What do you think that the reason is of your trouble? Then I have already the information. So when you come back and you start talking again about the same, is when I said to you, have you not already suffered enough? Because you are suffering while you're telling me, right? Look at you, stop. Don't say anything. Look at your body. Look at how are you sitting? How are you breathing? And then, after we do that, tell me, do you really want to talk about this? Because you have told me already. So I know, you know. Why don't we move forward? Why don't we try to rescue what you have? And you have beautiful memories inside there. We try to get that, and from there, maybe, you cannot promise. It's always maybe. Maybe you will be able to start feeling well again, better. That's what we do through your aromatic positive memories. What is the administration route that I use? We use voice, smell, and touch, and then I integrate it through this heart process session. All three administration routes integrate and combine to have this balancing and focusing effect on the person that will decrease the anxiety, that will provide a concrete and positive feeling of well-being. Many people said, oh, I'm so agitated, I need to calm down. Other people said, you are so depressed, I need to give you rosemary and just jump up. Well, if you do that a lot, you can get into a kind of bipolar, and you are going to be manic and depressive and manic and depressive. And for me, the trick is to get balanced. Balance. In the Netherlands, we have a saying, and it is, do normal, because that's already crazy enough. You know, so that is what we tell the patients. Balance. That's what you need. You need to feel that you are in a state of mind that you can prolong. If I'm very happy, I will be happy for what? A second, 5, 10, and then what? I go down again. But if you are not happy, but feeling well, feeling joy, feeling just normal, that's already a lot of happiness. And you can take that along the day. Of course, we're always trying to work personalized in aromatherapy. I really believe that that is the only way, in a way, to work with, to achieve very quick results. But of course, if you work in a hospital, you don't have the time. And nowadays, we get less and less and less time, unfortunately. But you have to have generic blends. So what we do is that we prepared different blends, and we categorize oils as being calming, balancing, or stimulating. Some of them are just calming, or some of them are just stimulating, and some of them are both, or 3 of them. And this is, I have here the list of oils that we use, and with what we consider to be balancing or stimulating. Remember that all of them are always very diluted. So what we do, we present them not with lavender, lemon, and vetiver. Because if I said to someone, here I'm going to make you smell lavender, they already know, oh, I need to be calm. Oh, I am not sleeping well. Oh, so I'm just go into what lavender is. If you just show them this and tell them, look at the colors. Look at that. Can you tell me where lavender is? They don't know. So why don't you just look at the numbers? Pick a number. Look at those little bottles and tell me which one you want to smell first. And then they will pick it up, they will smell it, and then we will see if they are good. Not really. Of, oh, no, this is not for me. And of course, if someone takes an oil and said, oh, this is lavender, and you know that number 7 is really not lavender, we don't tell them, no, you're wrong, because they're always right. They're always right. So instead of saying this is not lavender, what I said is, oh, so you like lavender? Wow, where does lavender bring you to? And they're smelling it and, oh, and they start, remembering and evoking these aromatic memories that I will use later to put it into the blend. But I will never negate what they are feeling and tell them, no, that's not lavender. That is clary sage, for instance. So they have to feel what is good for them. We're working with moments. Emotions are felt in a moment. If you are anxious, you are not anxious 24 hours a day. There are moments of anxiety. There are moments of happiness. There are moments of tranquility. Those are moments that we try to recreate in the blend. And of course, the blend will have their own name. They put the name on the blends. And we use between 5 to 7 oils of the good oils, and we create a blend. And we do it together. So I take the aroma stick, and they take the bottle, and they count 1, 2 drops, 1 drops, etc. So they prepare their own medicine. So you are giving them the responsibility of their own healing. And this is very, very true, especially for children, because if I give a child with ADHD and I said, okay, you're going to use this stick 3 times a day for 1 minute, then you put it on your pocket, they will say, yes, okay. And he will use it because mother is there. But he will use it at school? Of course not. Because this guy is crazy. But if I take them into the game and I said, look, we can use an aroma stick, we can use a roll-on, we can make something for the shower, we can do something that will be very special for you. And you're going to do it. So he takes the oil. He liked it. I said, can I smell? Oh, no, this is horrible. This is not for you. And the other way also. We play together. So he starts being empowered. I'm preparing my own. So it will work. Because I have decided, not this guy, I have decided. He didn't like it, but I do. You give them responsibility. Very important. And we bring them also into this vivid journey. We use an aromatic patch, for instance, or they have an aroma stick in the hand while we are performing the hearts. And they are just, as I said, talking remembering, telling you how happy they were, how good they were. And that's the way they want to be remembered. Because nobody wants to be remembered as being 35 kilos, just bones, in pain, and looking horrible. No, I want to be remembered when I was having a glass of wine, a good meal, smiling, and being happy. That's how I want you to remember me. And we prepare blends for the whole family that will bring this memory of a holiday where they were together, they were happy, and they will remember. We do meditations together with the family and the patient. So when the person is gone, that remembrance remains very important. And I'm here for you. This touch is so important. It's energetic exchange. I'm here for you. That's what it counts. It's an intentional touch, as I said. So we have the intention to provide what they want. What do you want? I want mama. I said, okay. Then I will use some essential oils and I will just touch your head, or I will cuddle you just there, and I will go, and that is what they need. They don't need me to talk and talk and talk and talk because I am a psychologist. No, they want just to be cuddled, to be comforted, to be held. That is what we do with hearts. And what we see here is a mutual transmission of the heart. Because people think, yes, hearts has to do with the heart. No, has to do with hands-on empathy, aromas, relaxation, textures, and sound. But after all, is from your heart to their heart. We communicate through the touch. We communicate through the aromas. We communicate, we exchange. We provide the comfort they need. So if I conclude, we have seen that the use of certain aromas, as I said, certain aromas in a very, very diluted way, it gives people tranquility, they give peace of mind, they give them the capacity to have a better quality of life. And if they are having pain all the time, and there is a moment when there is no pain, and you bring the oil, is when they go and said, oh, this is what I needed. This is what I needed. Because these oranges bring me back to Italy. And you know, when we were there, and then they start talking. And they are talking and talking. And then after 10 minutes, you said, how is your pain level now? What? Oh, you see? You see that you are not pain? They are not 24 hours with pain? That you can distract your mind, because that is the power of aromatherapy. We can distract the mind from the pain focus to the well-being, to that memory. And if I am touching you very subtle, and I'm doing some very, very small and very slow movements, you are feeling that I am here for you. That's what you need. And I teach the family to do hearts for them. I teach the children. It's so fantastic to see a little girl or a little boy who go to visit the grandmother, the grandfather, who is in bed in the living room. He's going to die, you know, oh. But I am 7, 8, 10 years old, And I said, come here, I'm going to teach you. We're going to do it just on the feet. Ask your granddad that he wants. Yes, okay. So I teach them how to touch them. And then to look at the eyes of your grandfather. And then the grandfather is looking and they smile. You know, they're saying, I love you. Thank you. Thank you for being here. Thank you for being here for me. That is what the granddad is saying. And that is what the child is also feeling. And that is something that they will have for the rest of their life. That remembrance, I did also something for him. I was there. I was not afraid of touching someone who is so sick. We don't need to be afraid. They need it. And we can do it and we can give it to them. The last thing is to remember, hands-on, we touch, empathy. We try to be there for them as being what they feel. We use the aroma to distract the mind from the pain, to bring them back to well-being. Relax, because they need to relax themselves. If you're sick, you're always in stress and then in distress. So we relax them. Textures protect you, make you feel safe. You know, you just more and more, your own shawl, your own clothes makes you safe. And the sound is because they need to talk. They need to express what they feel. And they don't express that to the family all the time, but they do to you as a therapist. They tell you the truth, how they really feel. And then you said, I'm here for you. The last thing is that I was just recently published a book that I wrote about emotional palliative care. And it's a special kind of book because it's written for the patient. The person who inspires me this book is someone who said to me, everything you have done with me is very nice. You have given me books to read. You have helped me with Netflix documentaries. You have taught me about supplements, everything. But at the end, what it really helped me is when you were here. You were touching me. You were telling me it's going to be okay. And that is what I need, because at 3 o'clock in the morning, I wake up in pain. I call the hospital. They have to come. But what do I do in between? Then I go back into my aroma stick and I just try to remember. I try to do some breathing exercises. I just want to remember that beautiful thing that we call life. Thank you very much, everybody.